thing I wanted to point out here is the cortisol. We hear cortisol with stress, being the big bad boogeyman. Ultimately, high cortisol can reduce the effectiveness of your immune system because it reduces the number of immune cells. But cortisol is our most potent anti-inflammatory molecule. It is designed to reduce inflammation. That's what it does. That's why you produce it when you're sick. It is the fail-safe mechanism to turn off your body's response to whatever it is causing the sickness. So ultimately, if your cortisol is too low, those people suffer tremendously from all sorts of inflammatory insults. If your cortisol is too high, then what it does is it shuts down the part of the immune system that deals with bacteria, viruses, parasites, fungi. But it turns on the part of the immune system that deals with allergy and autoimmunity. And this happens very frequently in our culture, that stress enhances allergy, and stress is like gasoline to an inflammatory process, an autoimmune inflammatory process. If something is smoldering and you're very stressed, it will just pour it on. So I think we talked about estrogen a bit, I won't go into that. And I think we also mentioned this with testosterone. So I just wanted to mention also, because some people think that there are multiple types of arthritis, and one is inflammatory and one is not. Right? The inflammatory one is rheumatoid arthritis or psoriatic arthritis or ankylosing spondylitis. There's a list of the inflammatory rheumatidities. And then osteoarthritis, which we think of as something that happens when we get older. It doesn't have to happen, but that's what we think of it. We think of that as wear and tear. Well, the bones and joints are not being worn and torn in people in Okinawa, in Costa Rica, in Sardinia. And those people are in their 90s and 100s. It doesn't have to happen. But it happens in our culture because we are basically killing ourselves with carbs and sugar. And when we have insulin dysregulation, insulin is one of the most potent inflammatory triggers that exist. And I would bet you that most of you all do not know your fasting insulin level. So somebody impress me if you know what it is. Okay, this is not your fasting glucose. This is your fasting insulin level. Your fasting insulin level will be out of balance way before your glucose gets to be out of balance. This is one of the things that I look at in people and say, hey, this is the time to work on changing your life. You have the chance to do it now, and it's pretty easy. Once it starts to settle in, it becomes much more difficult. But even osteoarthritis, the arthritis we associate with wear and tear, actually has a significant inflammatory component, and that's the component that breaks down the coating, the cartilaginous coating of the bones that make up our joints. It's not the mechanical abrasion. But when you think about the mechanical abrasion, then you're thinking about being in a hyperacidic state. What is that from? That's from alcohol, that's from carbs, it's from meat, from caffeine, those kinds of things. It is not from green juices. That is a wonderfully alkalinizing drink. And the more alkaline that we are, the more likely it is that we'll be able to preserve our bones. When I work with people who have osteoporosis or osteoarthritis, and I see those two things as going together, you're taking the calcium out of your bone and you're putting it into your joints. You're putting it into any place that's inflamed, and the calcium is coming out of your bones because your body is too acidic and your body is using the calcium as a buffer. So what's the answer? Work to alkalinize.
Excuse me.
Yes, ma'am.